What is a wicked problem? A wicked problem is a problem that is difficult or impossible to solve because of incomplete, contradictory, and changing requirements that are often difficult to recognize. Our wicked problem deals with the financial barriers and mental health and illness in America. Here we can see the people impacted by our problem: the general population, the mentally ill, the population of jails, and the private sector, which includes any private practices or institutions that is not receiving money from the federal government. The federal government is going to be the first topic that we talk about today in our video. Some government needs to fix this problem is to increase the grants to organizations already in place, such as the Substance Abuse and Mental Health Services Association, along with the National Institution of Mental Health. Giving more grants to these organizations will help reduce the amount of money needed to go to private organizations in the future. And along with that, we can give more grants to the private companies and organizations that are currently offering services in the mental health area. This will help reduce the amount of cost that they are asking for. In place, they will be getting paid by the government. Now we're going to be looking at one of the biggest issues for our wicked problem. Too many mentally ill are incarcerated in America. There are some needs that the jails have to fix these problems: offering support services for inmates, offering better medications for inmates, and offering community outreach services for inmates that are released and need community outreach services to help them get re-assimilated back into the population. This is the largest contributing factor to our wicked problem. Jails need reform immediately. The amount of mentally ill inmates in jails is increasing by the year, and the need for responsibility is evident. Our wicked problem also covers the bounds of the private sector. The private sector is any prison, private practice, or hospital that offers mental health care that is not funded by the government. Some needs to fix this problem is to seek out for more private organizations to help subsidize costs. This can be done by private donors, private organizations coming in and helping reduce costs for people seeking mental health treatment. The private sector also controls how much they offer for payment and services. This allows them the ability to control how much they offer their services for, so they can control how much mental health is currently being offered in the private sector. When it comes to the private sector, we have to look at how much money is being offered, and this breaks it down to the social classes. Higher social classes have more money to be allocated for their mental health, giving them a better treatment options in the future, while someone in a lower social class is not afforded those same treatment options. This alone creates a disparity between the quality of services provided by mental health in America. Some areas that we can implement are implementing mental health awareness education classes in middle and high schools to end stigma. Stigma is one of the leading causes for our wicked factor, as it produces a negative bias against people with mental health and reinforces against seeking treatment and help in general. Moving on to our beautiful timeline, we have the first date located 1960. This is when deinstitutionalization started. Now, deinstitutionalization refers to the removal of the usage of mental health facilities and asylums as primary care for mentally ill people in America. This not only helped the quality of care for mentally ill patients in America, but it just put the large quantity of fiscal responsibility of mental health onto the government. In 1981, President Reagan signed the OBRA, which stands for the Omnibus Budget Reconciliation Act, which established block grants for the states to provide mental health care, but further cut federal spending by 30%. In 2007, the average amount of money spent per day on an inmate was $80. Adversely, the amount spent on a mentally ill inmate was $130 per day. This creates a huge disparity between the amount of money that these prisons have to allocate towards inmates with mental illness and the amount of money that they're willing to spend each year to help. In 2008, the recession hits, and this increases the amount of money spent on an inmate per year. In 2016, we see the average inmate cost is $99.45 a day. Now, we couldn't find the average cost for a mentally ill inmate in today's day and age, but we assume that the cost would go up with the average cost of an inmate. In 2017 to 2018, we saw a $100 million deficit drop in community health services allocated from the government. And in 2018, the budget for the National Institution of Mental Health overall for observations dropped $300 million from the previous year. Overall, the number of people with mental illness in America who are incarcerated or homeless is 3 to 5 times higher than the general population. Now it's time to talk about a solution. The best solution that we could come up for was advocacy for mental health. The way we can advocate for mental health is by creating community-based outreach programs, ending stigma in society, and fundraising for mental health charities through awareness. I believe our biggest challenge is ending stigma in society. It seems to be the greatest factor causing our wicked problem to increase. Along to some more fiscal solutions to our problem, increasing money in government funding instead of decreasing, higher taxes, which always goes over well, and evaluate those who are mentally ill in jail and see if they physically need to be there. Thank you so much for your time, and let's please help end stigma and give more money to mental health in America.